Renner, Dr. Ayodele Renner is a child health advocate, medical doctor, and consultant pediatrician with at least 100 years of active clinical work, research, and training. He is also a social media influencer and health content creator, known on Instagram as a noisy Niger pediatrician. If you are here, you are a mother, you don't know Dr. Renner. Who do you know? So he was going to be talking to us about common childhood illness, what every parent should know, and when to seek help. Please, Dr. Rena, the floor is all yours. Do your magic.
So thank you so much, Nancy, Mama Talia. In short, you're going to send me money for the extra time. We'll talk in
Yes,
camera.
yes.
So, in short, thank you so much, Labake. Thank you so much, Ify, for inviting me, and thank you again, Nancy, for that expose on self-care and on self-care for moms. I mean, are any dads in here? Maybe dads too. Shey una dey
Yes,
take
so
self-care too.
yes, so we are here
The,
too.
the the dad should be here for both discussions, So moms, please take care of yourself. I think it requires a little bit of selfishness to be holistic. And I don't even think we should actually view it as selfishness because at the end of the day, you really cannot pour out of an empty cup. So, let that be said. So thank you once again, Nancy. Brilliant as usual. So, moms, it's good to be here. Good to see all of you. Nancy has already gone through the emotions. So if you are here, just throw out any emoji, whether it's a heart, applause, thumbs up. If you are still ready and available for us to go into the next, fantastic. Thank you all so much. Brilliant. Fantastic. Thank you, thank you, thank you, thank you. Great. So we're talking about common childhood illnesses. Common childhood illnesses, very, very important topic. Let me just open and see. So it's common childhood illnesses, what every parent should know and when to seek help. I think I would like for this to be as interactive as possible. I'm going to just talk for about Alabaka, what's the plan for Q&A? Is it at the end of all the presentations or can Q&A come immediately after my talk?
At the end of every session.
At the end of every session. And Nancy now didn't get Q&A. Okay, no problem.
Uh,
Just
uh,
prepare for no problem. Just prepare for Q&A. So let me just time myself. So I'll do 15 minutes of the talk and then 15 minutes Q&A because I find that when it comes to infections, there are lots of questions that mothers want to ask. So let me just get it started. Number one, infections. Let me just define what infections are. So in essence, infections are the presence of signs and symptoms after an organism, a microorganism, gets access into our bodies. So sometimes microorganisms get into our bodies, but they don't show any signs and symptoms because maybe not enough of the microorganism got into our bodies, and we just don't come under with signs and symptoms. But by the time a microorganism, whether it's a virus, whether it is bacteria, whether it is a fungi, gets into our systems and causes symptoms, that is an infection. Now, the type of symptoms that a child gets will depend on the type of infection they have. For instance, the main commonest infection that children have is cough and catarrh. Cough and catarrh is usually as a result of a virus that causes the common cold. So, well, I mean, if I had $1 for every time a mother complained to me on, even my mom's group, or even, maybe if you're referring somebody to me about, oh, recurrent cough and catarrh, then I'd be, that would say, money na water, na ya go dey talk by now. But you see, it is so, so common. And the reality is that when a child enters school, they are entitled to at least 8 episodes of these cough and catarrh every single year. At least 8 episodes. And that is because when children come and interact with one another, it's very easy for them to transmit viruses from one person to the other. I always cite the example of how a mother in my comment section that was also a teacher said that, she saw a pupil in her class picking kata out of the nose of the other pupil with their finger. Now, I mean, tell me, that's the one that she saw. That's the one that she saw. The one that she did not see, uncle. That one will take the kata and rub his eye, lick it, potentially lick it. I know that these are things that they do, share spoon with one another, and this way viruses transfer from one person to the other. Sometimes, even when a child is at home, like a child that has not started school, the older ones will come from their school with cough and catarrh and bring it to the child that is at home to begin to share it around. And so when a mother brings a child that hasn't started school, a baby that hasn't started school, and they're like, "Oh, my baby has cough and catarrh and a fever," I'm like, "Oh, does anyone else have cough and catarrh in the house?" And they say, "Yes, the older one has." And then I'm not like, "Oh, it's the older one that gave him the cough and catarrh," and they're surprised and they're like, "How manage?" So that also surprises me that, "Oh, but don't you know that these things are communicable? It's transferred from one person to the other." The first thing that they ask me is that, "Oh, doctor, maybe I should turn off the AC, or maybe should I not use AC for this baby?" I'm like, "You, inside this burning weather that is trying to show people preview to hellfire, are you not using AC for yourself? I now don't want to use AC for this baby. Please, mommy, it's not the AC that's causing this cough and catarrh. See, that your toddler in the house is that has brought that cough and catarrh back home to your child." Now, as children grow older, they tend to get fewer episodes of this cough and catarrh, meaning that between when they start school and when they are 5, they might have very little episodes. But as their body gets exposed to more and more of these things and their immune system gets more familiar with these infections, then it tends to get less severe and, not so, and it lasts for a shorter period of time. But that being said, the most important thing to do in terms of prevention of these cough and catarrh episodes is prevention of exposure or contact of a child with other children that are coughing. Now, if a child is going to school, that is very difficult to do. Very, very difficult to do because other parents, unfortunately, are bringing their children with cough and catarrh to the school. And I know you saw that my post that said that, you know what? If your child is having cough and catarrh, don't keep them at home. Do not keep them at home. As long as they are not having a fever, there is absolutely no reason for you to actually keep your child that is having cough and catarrh at home. Send them to the school. Let it go round. Not necessarily that you are trying to make it spread, but if your child is not having a fever, they are unlikely to be so highly infectious that they will, spread it. But the problem is that actually some parents, they know that the child has a fever. But you see, the reality is that a lot of parents don't have options in the sense that, okay, my child is having a fever, cough, and catarrh, but if I decide not to send the child to school, where will I keep the child? My office does not have a creche. My office does not have any kind of daycare. I don't have any help. Nobody I can leave the child at home with. Nobody I can send. No neighbor I can give the child to. No parents or grandparents to, take care of the child. And so they have to take the child to school. So that is how this thing circulates. So the sooner we begin to teach our children things like cough etiquette, adequate hand washing, then the more likely they are to imbibe these habits, such that by the time they are 3 years old, they understand that they are coughing into their elbows. They are washing their hands as soon as they come back from outside. They are washing their hands. So teaching is not something that, oh, it will just fall upon them. By the time they start school, we must begin to teach them. Cough etiquette, we must begin to teach them. And think about it. If everybody did that, then everybody would know what to do when it comes to preventing transmission of these viruses from one person to the other. The other infection that I think I must touch on, or maybe before I, move, what is the treatment for cough and catarrh? Because cough and catarrh is the most important of these infections. Unfortunately, we need to understand, how to differentiate between cough and catarrh that is just the mild common cold and cough that is a pneumonia. Once you think that a child is actually breathing fast, please, that is a reason for you to go to the hospital because it might no longer be the simple common cold, it might now be a pneumonia. So if you think that your child is breathing fast, no matter the age, that child needs an evaluation. If a child, that it has the cough and catarrh and is still active, is playing, is eating, but just feels a little bit dull whenever the fever comes, you can still observe, offer paracetamol for a fever, but once you notice weakness, refusal to feed, particularly in children that are less than 1 year and they are drinking less than 50% of their usual fluid intake, that's a reason for you to go to the hospital because it might be getting a little bit severe. For young babies, children who are less than 6 months, once their nose is blocked, there's a tendency for them to not want to feed so well because When their nose is blocked and they're trying to suck, they are sucking, if they're feeding, if they're breastfeeding, or they are trying to suck from a bottle, they struggle to breathe because their mouth is obstructed, their nose is obstructed, and they have to take their mouth off the breast quite frequently. And that can be uncomfortable for them, and they might have difficulty feeding. So if you notice difficulty with feeding, refusal to feed, constant vomiting, please, you need to go to the hospital at that point in time. Fever in itself is terrifying, but that in itself alone doesn't really tell us about the severity of the illness. So I'll see some children and the fever is there, but they're active, they're playing, they're happy. We generally reassure moms and say, you know what, just give paracetamol, just observe it for the next few days. If the fever persists beyond 3 days, then you can come back and then we can reevaluate. Now, people always think that, oh, cough and catarrh, oh, maybe it should last only 3 days. It's not true. It is not true. In my experience, a child that develops cough and catarrh from the common cold will have those symptoms for between 7 to 10 days. So when mothers come after 2 days of using maybe the drugs that we gave, maybe some antibiotics, say, but he's still coughing. Mommy, I'm sorry. He's still going to cough for the next 10 days. That cough can last that long. So we need to manage the expectations and say that, man, this cough is not likely to go away as quickly as we imagine that it will. Or moms come and say, oh, doc, he has started to sneeze, he's having catarrh, he's having cough. What can I do to slow down the progression? I don't want it to progress. I made a post and said that cough, not only will it progress, it will prosper because there is a course of things in which these infections will go. The infection will get worse before it gets better. They will cough more before they cough better. Another point is that cough syrups do not work. Cough syrups do not work. Cough syrups. As a matter of fact, what they actually say is that remedies, once a child is above 1 year, you can give them a nice mixture of ginger, honey, and lemon. Throw in garlic if you don't mind the smell and give them a teaspoon morning, afternoon, night. And that actually offers them a little bit more relief than the cough syrups that are over the counter. And please, 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 let us not give any children that are less than 2 years old cough syrups unless you have spoken with your physician. Because we actually try to avoid those cough syrups that are drowsy and that make infants drowsy. Because sometimes they have side effects that can suppress breathing. And that's the last thing we want in a very young child. So please avoid cough syrups in children that are less than 2 years. Apart from the fact that they don't work, side effects can actually be quite dangerous. How do we prevent? This is where nutrition comes in. So as much as I've said that once children are exposed to these infections, they will come down with them. Nutrition is so important, and which is why I'm so happy that it is Nutrition for Kids that is doing this. Because adequate nutrition, fruits and vegetables, adequate amounts of protein are very important to keep the immune system competent to make these episodes less severe. So good nutrition, unfortunately, will not completely eliminate the possibility of them coming down with cough and catarrh because a lot of mothers complain and say, oh, but I give fruits, I give vegetables, I give vitamin C. How come it's still coming down with those things? Once they are exposed, they will come down with the infection. But the difference between a child who will have the infection and be quite sick and the one that will have the infection and will just have it as a mild infection is very dependent on their immune system and how well their immune system works. And nothing does a better job at making the immune system competent than good nutrition. It is a fact that malnourished children tend not to do very well fighting off infections the way children who are well nourished will. Now, let's talk about, because I know I'm still going to ask questions. Now, let's talk about gastroenteritis, which is the acute watery diarrhea. So, watery poo-poo, another very important infection that is very common that children get a lot. That usually is from dirty hands. When a child has watery poo-poo, I ask a few questions. What are the hand washing practices in the home? Has anybody new been introduced into the care of that child or into the care of the children at home, whether it is a new nanny, a new caretaker, and sometimes these caretakers can be our relatives, an aunt, a cousin, grandma, because as well-meaning as grandmas and all these cousins can be, sometimes if you actually ask them question, okay, after using the toilet when you go and poo-poo, Show me how you wash your hand. Of course, it might be difficult to ask your mother-in-law, but at some point, get somebody to ask her. You find out that all they do is just run their hand under water. They do not use any soap. And so underneath their nails, you find out that there's some poo-poo, there's some material from the toilet, and that's the same hand that they're going to use to go and feed your child, that you carry for 9 months. So these are the challenges. I also ask, has the child started to crawl? When they start to crawl, it becomes a problem that because they are putting things in their mouth, whether it's shoe or whether it's pakao, they'll put those things into their mouth. So those things tell us that things have changed. Sometimes also is the school, maybe school, you've changed school, you've moved to a new creche, and you see the problem with gastroenteritis is that they can lose so much water. A 10 kg child, the amount of water that they need to lose to become severely dehydrated is just 2 sachets of pure water. 2 sachets of pure water is all they need to lose from their body for them to become severely dehydrated and almost go into shock. So that's the last thing you want to do, is to make them have this gastroenteritis. The problem with gastroenteritis and watery diarrhea is that sometimes it can come with vomiting, such that everything that they eat, they will throw up. If that happens, you definitely need to go to the hospital. One of the most important indicators for us that a child is dehydrated when they are having this watery diarrhea is the number of wet diapers that they have. For those children that are in diapers, those babies that are in diaper, we normally want them to have between 5 and 6 wet diapers in a day. If they are having anything 4 or below, then it means that they are dehydrated and you need to take them to the hospital for care. If they are vomiting absolutely everything that they are eating, whether it's breast milk, cereal, whatever it is, then you definitely need to go to the hospital. If there is blood in the stool, if there is blood in the watery stool, that definitely requires a hospital visit. Fever, neither here nor there. If you are really worried about the fever, then please take to the hospital, but it's not 100% that we are concerned. If there is weakness, such that they are so weak that they are refusing to eat, please take to the hospital when they are having watery stools. I wanted to cover those two ones majorly, because those are the two commonest childhood illnesses. The other ones that I think just deserve an honorable mention include an ear infection, and that's because ear infections may not necessarily show with any other symptom apart from a fever. Sometimes you might have ear discharge, but when you go to the hospital and the child is having only temperature, it's customary for us to look into the ears to see if there's an ear infection and into the throat to see if there's also tonsillitis. So these, I think, are some of the high points I wanted to highlight when it comes to common infections. So please, I'd like to take questions over the next 15 minutes before we round up. Hello, Labake, you there? Think you're muted. Hmm. Okay, I'm not sure Labake has dropped off. Okay, I've seen a question that says I should talk about tonsillitis. So, tonsillitis, tonsillitis is essentially is an infection. So, how do we prevent or minimize infection in kids? Not just cough and catarrh, more like bacterial infections. Well, the truth of the matter is that it's all the same principle. Number one is avoidance. Avoid exposure, avoid exposure. And you see, I cannot shout about avoid exposure enough. I know that it can be difficult, but you see, if we preach this gospel of everybody making sure that everybody is washing their hand and covering their nose and mouth when they cough, then it's better. And you see, the problem is that when a person gets the common cold, or what we might think is a simple viral infection, we know where it will start, we don't know where it will end. Some children, good immune system, good nutrition, and that virus will go to their brain and they will get encephalitis. Not because they are not well nourished or anything. So I cannot stress it enough. The idea that run away, flee every appearance of evil. Because simple virus, something that the child had that was not an issue, and they will develop a brain infection. God forbid. Like so I cannot shout it enough that keep coughing children away from coughing children. Children with fever, children with cough and catarrh. Like if you can help it, avoid being in their vicinity. Because while most of them are mild and will go away by themselves, there will be those ones that will be complicated. That being said, so whether it's bacterial, whether it's viral, number one, avoid contact with people who are ill. Number two, good nutrition, good nutrition, good nutrition. Excellent hygiene, whether it's in the home, clean the house. Make sure that when you go to schools or you are choosing a creche, you are vetting their hygiene and their hygiene standards. They must have a protocol that you can actually read and look at to say that this is how often we mop, these are standards for hand washing, these are what our hygiene protocols are, this is what our protocol for, sick children coming to school are or is. Let that be one of your criteria for deciding whether your child can stay in that school or creche or not. Now, tonsillitis. So tonsillitis really is an airborne infection majorly. When somebody coughs or sneezes on somebody else, the tonsils, which are tissues at the back of the throat, get infected. And when that happens, they can cause fever, difficulty with swallowing, difficulty with breathing sometimes if the tonsils enlarge enough. The problem is that sometimes tonsillitis can become chronic, such that the tonsils are just constantly enlarged and they will be snoring in the night, they will be having catarrh, they will be snoring like tiger generator, fra, fra, and you need to see an ENT who might give some drugs. And sometimes if the tonsillitis lasts for long enough, then I actually need to do a surgery to remove the tonsils. When a child has an episode of tonsillitis, we generally tend to give antibiotics, just to make sure that we are killing it off, because we are not too sure whether that tonsillitis is bacterial or viral, so we tend to want to just give antibiotics to get rid of it. Now, the only way in which tonsillitis is diagnosed is by seeing the enlarged red tonsils. So please, if you go to the hospital, ask the doctor to kindly look into the throat to see if the tonsils are enlarged. So it is caused and spread airborne by from child to child or from person to person by contact. Thank you very much. My infant isn't ill but doesn't wear the diaper that much. Well, as long as it has 4 or more, then we are good to go. Please check the diaper every 3 hours, because sometimes, well, the diaper doesn't need to be soaked as long as he's peeing every 4 hours. Now, doctor, can an ear infection go on its own? Yes, viral ear infections tend to go on their own. But the truth is that if you come to us and we think that your child has an ear infection, and we think that you might not be able to make it back to the hospital in 3 days' time after the first evaluation, we can just start antibiotics for you. And then, or we give you antibiotics and say if after 3 days the fever persists, then please start the antibiotics. So ear infections can go on their own, particularly the viral ones. But as a general rule, if after 3 days the child has had a fever from an ear infection, it hasn't gone, then we tend to start antibiotics. Is it possible for a baby to contract cold and cough from mom and vice versa? Yes, it is possible for a mom to give her child cough and catarrh, particularly when the mom has cough and catarrh. So we say moms who have cough and catarrh, if you are breastfeeding, please wear a face mask. Please wear a face mask. And it is possible for a baby to give the mom cough and catarrh, particularly for those moms that suck the catarrh out of their nose with their mouths. It is very possible. It's difficult to avoid when they go to school. Oh, yes, it's very difficult to avoid when they go to school. So you either decide go to school or deal with frequent cough and catarrh. But nutrition for kids, I'm sure they have some very wonderful recipes and some very wonderful things that they can recommend for you to help to reduce the intensity or the severity of these cough episodes. Does teething really cause baby to run temperature? No, teething does not cause baby to run temperature. Very unrelated, but please, can you enlighten us on female genital mutilation? Is it true that girls not circumcised are more promiscuous? No, that is not true. That is a myth, and female genital mutilation is child abuse. So please, I had a friend who actually went out and she left her daughter with her mom, and by the time she came back, the child was crying so much, and then she looked into the child's diaper and realized that the clitoris was looking one kind, and the mom confessed to having pressed, maybe now pressure, female genital mutilation, pressed the clitoris, and poor thing was in just in so much pain. So please, it is not true. Female genital mutilation has no place in civilized society. So how do you help a toddler that does not eat well? Also, how do you boost her immune system against frequent viral infections? Well, of course, nutrition for kids, this is what nutrition for kids does. But you see, the truth of the matter is that when it comes to children who don't eat, eating well is very relative. So if you want to say she doesn't have a large appetite, and I think I should round up in the next 5 minutes. If she doesn't have a large appetite, that is one form of eating well. If she has of not eating well, if she has a very limited, range of things that she doesn't, like to eat, that's another form of not eating well. So are we talking about not eating large quantities? Are we talking about not eating a variety? Because the approach to the two is very different. If she's eating a large variety, but she's just eating it in small quantities, then that's perfectly fine. She's going to get a wide variety of things. But if she's managing to eat a large quantity of only one specific thing, then that's really problematic because at the end of the day, she's not getting the wide range of nutrition that you need to give her. So what can you do? Number one, have a meal plan, have a retinue, and have a repertoire and an arsenal of recipes that you can actually try to vary. And unfortunately, the reality is that when it comes to children who do not really like a variety of stuff, you just have to keep on trying a lot of things to see what exactly it is that they want and they like. Multivitamin supplementation is something that, of course, you should consider as well. My 2 year-old snores a lot with or without
Rena,
kata. Have him
sorry,
examined.
Dr. Rena.
So your questions
Yes, yes,
are
yes.
like 1,000.
In short, no vex. So I think
Dr.
we
Rena
can
has
just
a
close the
community.
question
Oh.
Q&A
If people
session.
have
Yes, I think
questions,
we have.
if people
Your
have
question,
questions, please
let me read
don't
out
be
the major
shy.
ones that I think will make the most sense for you to answer because if you keep going, you will not leave this place today. So
At
somebody
all.
asked a question about her 14-month-old touching her vaginal area, but there are no rashes or bruises. She's asking if that's normal or she should be concerned.
So 14 months old touching their vaginal area, not unusual. It's just play. Sometimes they actually put their fingers there. But what I'd say is that if you are the one bathing her, kindly, first of all, avoid washing too vigorously. And then you want to use a soap that is a little bit neutral. I don't want to call any brands, but just look for the one that the pH is around 5.5, So I think that's what we can try. Alternatively, please make sure that the diaper is actually absorbing the fluid or the liquid. But other than that, just pay attention to it, observe it. If she's touching it and doesn't seem to be in much discomfort, then you can just ignore it. If she seems to be in discomfort, then please try to use a neutral soap for bathing her.
Okay, I have one more question for you. I think this is a follow-up to the person that you were answering about the ear infection. She said the child is 16 months and they've tried many antibiotics right now, but the child still has an ear infection.
Okay, so you definitely have to see an ENT. The problem is that sometimes if the child has, number one, enlarged tonsils, then it's possible for them to have recurrent ear infections. Number two, if there's fluid in the ear sometimes needs to be drained of that fluid for the ear infection to completely resolve. The reality is that sometimes these ear infections are recurrent, such that one ear infection has actually gone and then they get another one, particularly if it's viral. So please see an ENT, and I think that will be valuable.
Thank you. I think I have one more for you, but I think you've already talked about it. Somebody is asking what can be done with catarrh persistent for up to a month, even after treatment. I feel
So,
like you've
so, so
answered
the
this
reality is
question.
that catarrh that is persistent for a month, even after treatment, and see, nobody has a catarrh that is from a virus every single day. Consider allergies, because if you and I have talked about this a lot. You know how sometimes if in your house there is mold, a person can come down with recurrent episodes of both cough and catarrh. And so you want to actually consider the fact that this child might actually be having some kind of allergy, particularly if there is no fever with this catarrh episode. So look around the house. Is there mold? Is there a family history of allergies? Does it seem as though when the child is at in certain places, the catarrh seems to get worse? When they leave those places, the catarrh seems to get better. That means that this might be an allergy that you're dealing with. Nobody has a viral catarrh that is there every single day for a full month. So consider
Yes.
allergies.
Thank you so, so much, Dr. Renner. We have to release you, if not, they will tie you with rope. They will tie you with rope. For the people who haven't
Me.
gotten their questions answered, we are going through them and we're going to read them, and then we'll also respond to you as well. Most of these questions
Yeah.
are questions that are what you will always experience if you have a toddler. The truth of the matter is we need to do, and I think this is going back to what Nancy was talking about. We need to spend a little bit more time paying more attention to our children. A child that has a cough constantly, and you keep treating for the same thing over and over and over and over again, the treatment is not the problem. There's something you're missing in your house, right?
Yeah.
Some people are
There's a
asking
trigger in
about
your house.
the eyes. See, so I gave a description to a patient yesterday. Your eyes, your nose, your mouth, your ears, they are all sharing the same canal. So if something enters your mouth, it will enter your ear, it will enter your eye, it will enter your nose. So if it entered your mouth and you didn't find out the problem early, it will travel to your ear. If you don't catch it in your ear, it will enter your nose. If you don't catch it in your nose, it will enter your eye. So you need to be able to figure out where is it coming from. And think about it. Children's heads are like this big. So it's more than likely that things will travel. So these are, I mean, I don't want to say that these are logical things, but if you've been paying attention from everything that has been said so far from day one, day two, all these things are things that by now you start asking yourself, okay, do I need to supplement? Do I need to join the PEDs Nutrition Challenge? Is there something I'm missing out in my house? What do I need to be paying more attention to? I need to calm down. Let me think straight, right? All of these things are things that we've been talking about day in, day out. But we'll keep answering more questions. Dr. Renner, thank you.
Thank you so
Thank you
much.
so much,
We really
guys. Thank you for having me, and
appreciate.
thank you, moms. You guys are
Thank
doing
you,
a wonderful
moms.
job. Thank you
Please
for caring for the constituency
let us
members.
appreciate Dr. Rena. Please.
Thank you.
Thank
Thank
you
you.